Hello, welcome to AI Medical School. In this video we are going to discuss the Rosivastatin drug. Overview. Rosivastatin is a lipid-regulating drug that belongs to statins. Rosivastatin is a selective competitive inhibitor of 3-hydroxy-3-methylglutarol coenzyme A reductase, an enzyme involved in the synthesis of cholesterol in the liver. Rosivastatin is used in the treatment of primary hypercholesterolemia, mixed dyslipidemias or homozygous familial hypercholesterolemia in patients who have not responded adequately to diet and other appropriate measures. Statins are more effective than other classes in lowering the low-density lipoprotein cholesterol. They reduce coronary events, all cardiovascular events, and total mortality. Indications. Rosivastatin is primarily indicated in conditions like hypercholesterolemia, hyperlipidemia, and can also be given in adjunctive therapy as an alternative drug of choice in hypertriglyceridemia. Contraindication. Rosivastatin is contraindicated in conditions like liver diseases, pregnancy, lactation, renal impairment, hypersensitivity to any component of the product. Side effects. Rosivastatin produces potentially life-threatening effects which include abdominal pain, myalgia, which are responsible for the discontinuation of Rosivastatin therapy. The symptomatic adverse reactions produced by Rosivastatin are more or less tolerable, and if they become severe, they can be treated symptomatically. These include dizziness, headache, nausea, asthenia, hypersensitivity, pancreatitis. Warnings. Rosivastatin therapy should be discontinued if markedly elevated creatinine kinase levels occur or myopathy is diagnosed or suspected. Rosivastatin therapy should also be temporarily withheld in any patient with an acute, serious condition suggestive of myopathy or predisposing to the development of renal failure secondary to rhabdomyolysis. Should be used with caution in patients who consume substantial quantities of alcohol and/or have a history of chronic liver disease. High-risk groups. Drug should not be given to pregnant mothers and patients suffering from liver malfunction. If prescribing authority justifies the benefits of the drug against the possible damages, he or she should re-evaluate them and consult the reference material and previous studies. Dosage. Adult dose, 5 to 20 mg per day. Single dose 12 mg. Frequency, as recommended. And route is oral. And these are some brand names: Rovator and Rosivastat. Thanks for watching. I hope you guys liked the video.